Taking a break from cooking, Tyler is here from Hometown Pharmacy, and we are going to talk Pain Relief 101. Good morning. Thanks for being here.
Good morning. Thank you for having me.
You bet. So I think it's happened to all of us. We've got some sort of pain or ache, and we're not sure exactly what to take, and that's why we love you guys at Hometown Pharmacy, because people can just come in and talk to the pharmacist in person, and you can help people out.
Absolutely.
So let's start at the beginning and talk about some of the different things that you brought, because sometimes it's hard to know what to take for what.
Okay. So I brought in a variety of different pain relief non-prescription items. I'm going to start with the topicals.
Okay.
And then I'll move into the orals and the tablets and capsules.
Okay. So let's go ahead and start with this. First of all, tell me about this Icy Hot patch.
Well, the Icy Hot patch, as well as the Bengay and the BioFreeze, kind of all very similar.
Okay.
They have menthol or camphor in them, which basically gives a cooling sensation, which deters our brain from feeling the pain.
Okay.
So giving pain relief. They come in patches, gels, and creams.
So this would be like for muscle soreness. I know a lot of my tennis ladies, will take, use some of these if they're feeling injured in some sort of way, and it's not too serious. So that's the type of thing you're going to use this for.
Yes, mainly muscles, a little bit of joint, but mainly muscles.
And does it work?
It works good. Yes.
Well, good to know. All right, moving on to some of the other stuff.
So the Aspercreme, that is a mild anti-inflammatory. So it's still going to be used for the joint and muscle pains, but it's kind of hitting a different angle at getting to the source of the pain.
Okay. So would you use these in combination together?
They can be used in combination. They actually do have products that have both concepts, the one to deter the pain relief and the other one with the anti-inflammatory.
Okay. And what are the other couples?
This one here is capsaicin. It's made with red peppers. It's kind of initially giving the tingling sensation to reduce the pain, but long term it actually will reduce the pain signal from being sent, in effect reducing the pain.
So do you like that one?
That one's good for arthritis pain.
Okay.
So more joint versus muscles.
Got it. And what about this one?
The last one is the lidocaine. It's actually fairly new. It was prescription, but now it's 4% as a patch and a cream without a prescription.
And how are you liking that one?
Oh, that one works good. That one's actually probably getting to be more popular than the others because it seems to be more effective, a little bit quicker acting.
And that's good. That's always good.
Yes, absolutely.
Yeah, especially when you've got some pain. Now you brought along some pills, some oral medications as well.
Yes. So those are probably the more traditional ones that we're used to. We have the acetaminophen or Tylenol. Mm-hmm. The important thing with that one is there is a daily max that you don't want to go over, which is 3,000 milligrams. And that is because it can start to affect the liver if you go over.
Yeah,
yes.
Real important.
Yep.
Now, what types of things would you take? I never know whether I should take Tylenol, whether I should take ibuprofen, whether I should take Aleve.
So there really isn't too much of a difference between the two when it comes to pain that you're going to take care of without talking to the doctor.
Okay.
They both can be used for just general pain. Mm-hmm. They both can be used for fever. Mm-hmm. But when it comes to, according to the package, there isn't really much of a difference for particular pain.
Okay. All right. So you don't really recommend one over the other?
No, it's more of what you've done in the past and what's worked.
Yes. Some of them, though, you need to take food with. Let's talk about that.
Yeah. Both of these here, the ibuprofen and the naproxen sodium.
Which is commonly known as Aleve, right?
Yep, Aleve. Mm-hmm. They're a group of anti-inflammatories. You must take those with food to reduce the immediate stomach ache and reduce the risk for affecting your stomach long term.
All right, good point. Now you've also brought along some natural, and you guys are really big on that, and that's a big trend. But the thing is there's tons and tons and tons of natural, what do you call them actually?
Supplements,
vitamins, out there, and then they're not all created equal, and that's where you guys really do your homework, and you've got the best of the best, because that aisle just keeps getting bigger and bigger, and it's more confusing. But there's some really good stuff out there.
Yes, you make a very good point that not all supplements and vitamins are created equal. Mm-hmm. It's a good idea to have a discussion with the pharmacist to find that good product that you're going to get the most bang for your buck and most effect that you want.
You like this line and you like these products. Tell me about that.
Yeah, so both of these are made by Orthomolecular. The first one is the Chondroflex, which is a glucosamine and chondroitin mixture. It's used to increase the joint, decrease the joint pain. It does need to be used for 3 to 6 months.
So that's more of like an arthritis, kind of an achy pain
Yes,
type of thing. Okay,
correct.
all right.
People with knee problems and then arthritis are the biggest ones.
And the other one you guys swear by, and some of the other pharmacists have talked to me about it as well. This is something to keep on hand when you just start to get that tickle in your throat, when you're just feeling like you might be coming down with something. Tell me about that.
That's our Viricid product. It's basically there to give your immune system a boost in 3 different angles. One, to fight the virus. One, to give your immune system a boost. And then the other one to restore the immune system once it's done fighting.
Yeah, you guys really like that. So he's a wealth of information. All the hometown pharmacists are. That's the great thing. They're hometown. They're all over Northeast Wisconsin. Tyler, you can find him at the College Avenue Appleton location. Stop in, talk to them. They will help you out. It's a pretty cool thing that you can get up close and personal with the pharmacist. So thanks a bunch. Appreciate it.
Thanks for having me.
You bet. Coming up, back to the kitchen to cook up some more delicious recipes. So stay with us.